Hi, and welcome to Kidney Plugged In. On today's episode, we share highlights from the recent Kidney Health and Organ Donation Patient Forum, which was hosted by the Northern Alberta and the Territories branch of the Kidney Foundation of Canada. First, we'll introduce you to Dr. Sandra Cockfield from the University of Alberta. Her presentation focused on living transplantation from a recipient's perspective, and she discusses, among other things, both the risks and the benefits of living organ donation. And meet Dr. Stephanie Thompson, Assistant Professor in the Department of Nephrology at the University of Alberta. She'll talk about the important role of exercise in supporting kidney health to ensure better health outcomes for kidney patients. This and so much more is coming up next, right here on Kidney Plugged In.
Thank you very much for asking me to give this talk on living kidney donation from the recipient's perspective. What I'm going to try and do during this talk is to illustrate the important role that living donation plays in kidney transplantation in Canada, to discuss some of the risks and benefits of living donor transplantation for the recipient, describe some of the key points that occur for a potential recipient as they explore the possibility of a living donor kidney transplant. So in 2019 in Canada, excluding Quebec, over 6,000 people developed end-stage kidney disease. Of those, 178, or 2.9%, received a kidney transplant as their first therapy. By the end of 2019 in Canada, there were over 23,000 people on dialysis. Of those 23,000 people, there were about 2,800 that were on a kidney transplant waiting list. During 2019, 60 people died on the kidney transplant waiting list. And during that year, we performed 934 deceased donor kidney transplants. So when one looks at the number of people who potentially would benefit from a kidney transplant versus the number of transplants actually performed for those people on the waiting list, it is pretty sobering. And if we could manufacture kidneys and pull them off a shelf, there wouldn't be a waiting list. We would just do that as quickly as we could and we would get people transplanted. But this is the reality, and it's the reality that is shared across the world in many countries. We do have another source of donor kidneys that we shouldn't forget about, and that's the living donor transplant. So this pink dotted line shows you the number of living donors over the previous decade from 2010 to 2019. You'll notice it's pretty flat. And when you consider population growth during this decade, the rate of living donation per population has actually declined slightly over this decade. In contrast, when you look at deceased donor activity, you can see some increase in activity. This is this top solid line with the open circles. So this shows you the accumulation of transplant activity over the decade from 2010 to 2019. The darker blue bars are the deceased donor activity, and the aqua bars are the living donor activity. So currently in Canada, living donor kidney transplants make up about a third of all kidney transplants that occur each year. So this is a very important source of donor organs, and it is one of those things that helps to keep in check somewhat the waiting list. If all of those individuals had to go on a waiting list, you can only imagine what that would do to waiting times. So what are the benefits of getting a living donor kidney transplant? The first benefit is the opportunity for a preemptive kidney transplant, meaning that you go from late stage kidney failure straight to transplantation without stopping on dialysis on the way. And as I showed, only about 3% of all individuals who reach end-stage renal failure in a given year have an opportunity of going straight to transplantation. This is obviously a huge focus. We would like to see many more people go this route and reduce the strain that we all feel in our dialysis units. A living donor transplant is associated with a shorter duration of dialysis. So even if you miss the opportunity of going straight to transplant, you can greatly shorten your time on dialysis to transplantation if you have a living donor. This is Canadian data for the 3 years between 2017 and 2019. And you can see that the median duration of dialysis prior to a deceased donor kidney transplant was 1,362 days. In contrast, the duration of dialysis for those who got a living donor kidney transplant was 275 days, a fifth of the time that it took for a deceased donor transplant. So that is also a huge benefit to individuals. It allows them to maintain better health as they're avoiding years and years of dialysis. It's definitely much less expensive to the healthcare system because dialysis is so expensive. It's also less expensive to the patient. There are a lot of hidden costs that the patients amongst you would recognize that dialysis patients incur. Simple things like driving to and from a dialysis unit. If you live an hour away from a unit and you're driving there 3 times a week, just think of the fuel bill that you've racked up. There may be childcare expenses and all sorts of other hidden costs that a patient and their family bears when they're on dialysis. And the hope is that transplantation would alleviate at least some of that burden. There's also better potential for matching, particularly if you have a related living donor, someone within your family who may share some degree of tissue antigens. And the more matching we can get, the lower the risk of rejection, perhaps the less immunosuppression or anti-rejection medication we need to use, and the better the outcome. And there's no doubt that living donor transplantation is associated with better both early and long-term outcomes. Early outcomes can be assessed by something simple. How many kidneys work right away when we transplant them? Well, for living donor transplants, 95% of them will work right away. For a deceased donor kidney transplant, that percentage that will work on average is about 80%, but depending on the donor type, the older deceased donor, or depending how the donor dies, we could have up to 40% of the kidneys or even more not working initially. They will eventually come around and work, but in the meantime, while we're waiting for that to happen, recipients do need to be on dialysis to support them. Probably most importantly, the long-term outcomes are also better with living donor transplantation. This shows you graft survival divided between a living donor in the dark blue and a recipient of a deceased donor kidney. You can see that at 1 year, there's not a huge difference in the outcomes. There's just a couple of percentage points. But when you start to extrapolate out to 5 years or 10 years, by the time you look at 10-year graft survival, what proportion of kidneys are still functioning at 10 years, there's a 14% difference. So this is particularly important for our young people. If you're 20 years old, you may well need more than 1 kidney transplant during your lifetime. And the more we can have that first kidney function for as long as possible, the less likelihood you're going to need a second or a third transplant. So long-term outcomes are superior. For that reason, a living donor transplant is by far the best treatment for kidney failure. Well, what are the risks of having a living donor kidney transplant? Obviously, the first risk is just the risk of having a transplant. And that's true whether you're getting a kidney from someone who dies or a kidney from someone who's alive. In many ways, the risks of the kidney transplant are actually lower with the living donor transplant. I think the other set of risks that perhaps we don't totally appreciate is sort of the psychosocial risk to the patient. I think often patients are afraid of what's going to happen to their potential living donor. I think patients can experience guilt if the donor experiences a complication. There's also guilt in a patient if the transplant fails, even if it's through no fault of their own. Just the fact that that kidney may not have lasted as long as one would have expected or hoped can create a lot of guilt that someone put their life at risk in order to give them that kidney. And in some cases, there's a sense of owing the donor something. This person has given this tremendous gift, but there can be this sense of obligation that as a recipient, maybe you need to do something as well for the donor. And for some people, that's a challenge to face.
Did you know that 77% of Canadians waiting for a transplant are waiting for a kidney? And that the average wait for a kidney transplant from a deceased donor is 3.5 years? And did you know that in 2019, kidney disease was the 10th leading cause of death in Canada? Did you know that you can be part of the solution? Every year, living people donate one of their kidneys to help someone suffering from advanced renal failure who needs a transplant to regain their health. In fact, 29% of adult kidney transplants are made possible by living kidney donors. And more than 53% of all adult living donors are not blood relatives to the recipient. Are you considering being a living kidney donor and wish to speak with a mentor who's been through the experience? The Living Donor Mentor Program is available for anyone who is considering being a living kidney donor to a recipient in BC or the Yukon. This free peer support program offers to match potential living donors with mentors who've already donated a kidney. Contact the BC and Yukon branch for more information. And now you know.
There are a variety of reasons why people may choose to go into this Parrot exchange program. This is basically a donor swapping program. It was established in Canada in 2009. It's a national program, so it has advantage of numbers. And patients can go into this program with one or more approved but incompatible donors. And what we try and do is we identify ways in which donors can be swapped between pairs. Many of these include blood group O recipients because of that blood group disadvantage. Match runs are conducted every 4 months, and you can see the numbers over the first decade of activity. Over 1,000 people participated on the recipient and donor side. There were 146 non-directed anonymous donors. I'm going to come back to that because that's really important in the success of this program. And in the first decade, over 660 transplants were performed. 550 went to patients who brought a donor into the system. But you'll notice 113 went to waitlisted patients. Well, how did they get involved in this? And they get involved through what's called a domino chain. This is the simplest kind of paired exchange. You have two pairs, their donors are incompatible with the recipient that they want to help. And so those kidneys are simply swapped. Donor A will give to recipient B, the pair B, and that person's donor will give to the recipient of the pair A. So that's a simple two-way swap. Now it can get more complicated. This is a three-way swap, but it could be a seven-way swap, where the donor in pair A gives to the recipient in pair B, the donor in pair B gives to the recipient in pair C, the donor of pair C gives to, and on it goes. And at the very end, there's a kidney that comes out from the very last donor that goes back to the recipient in the pair that started the chain. This is a closed chain, and it can have 6, 7 pairs, potentially more. It's just the logistics get very challenging. But the really important chains are what are called the domino chains. And a domino chain involves a non-directed anonymous donor. You can think of this person like a blood donor. They show up at Canadian Blood Services, they give a unit of blood. They have no idea where that unit of blood is going to. They just know they've helped someone who needs a unit of blood. A non-directed anonymous donor is the same. They've heard about long waiting times. They have this great desire to help. And so they come forward. They don't know anyone who needs a kidney, but they would still like to be able to donate a kidney to someone in need. And we encourage these individuals to participate in the paired exchange program. And you'll notice that the other important person that participates in this is a patient on the wait list. So what happens here is that you have this non-directed donor who donates to recipient A. That person's donor donates to recipient B, and donor B donates, and on it goes. And at the very end, there's a donor kidney in the very last pair that comes out, and it actually goes to someone on the waiting list. So this anonymous donor could have donated directly to this person on the wait list. But by participating in the paired exchange program, they've actually helped create a chain of kidney transplants, as well as getting the person on the wait list transplanted. So this is a critical piece of the success of the Parrot exchange program. And you can see in this solid line that the percentage of kidney transplants done through the Parrot exchange program in any given year, between 40, 60, 65% of them are created through those anonymous donors who participate in KPD.
Can you imagine losing most of something without realizing it? Over time, kidney disease can destroy up to 80% of kidney function before you notice any symptoms. Talk to your family doctor to see if you're at risk and need to be screened. It could save your life.
So the title of my talk is The Role of Exercise in Supporting Kidney Health. So what I'd like to talk about this evening is I'd like to talk about the role of exercise and physical activity in promoting and supporting health in people with kidney disease. I'd like to talk a little bit about the research behind that, scientific research, and also the patient experience. And I also want to talk a little bit about how we can make moving more easier and part of our kidney care culture. So I think it's really important just to always acknowledge that the effects of kidney disease can affect your physical functioning. And this isn't always clearly explained, that there actually is a pathophysiological reason why you don't function physically as well. So I'm going to highlight this with a common example. So when the kidneys stop working very well, you might know that they stop clearing acid from the blood. And sometimes your doctor will put you on sodium bicarbonate, and that's why we put sodium bicarbonate in the dialysate if you're on dialysis. So this is what happens when the kidneys start to fail. Acids start building up in the blood. And we know that that can actually lead to fatigue. So the effects of the acid on the muscle can actually cause it to not reform muscle as strong. So one of the effects of that is people feeling tired. And we happen to know that fatigue is a very common complaint among people with kidney disease. So what happens if you feel tired is naturally you're not going to want to engage in physical activity. And then when you don't do physical activity, the body does miss out on that opportunity to grow back stronger. So you may have heard, if you don't use it, you lose it. And this is sort of a fancy way of explaining this. So if you don't break your muscle down and let it build back up stronger, then it won't get stronger. And if you don't let your heart pump and your body work and your blood pressure lower when you exercise, you don't get that benefit. What happens next is we see this as a decrease in endurance and muscle mass and strength, and also in balance and coordination. And so what does that lead to? Well, you see that in your everyday life. It gets harder to get upstairs. It gets harder to play with the grandkids for longer, and people tend to feel more played out. And then overlaid on top of that are the effects of kidney disease. So when I say uremia, I mean the kidney toxins. Inflammation is higher with kidney problems, and then nutrition's harder. And nutrition's harder for a lot of reasons. It's a lot of reasons to do with the things that we say that you can't eat, and also just having a loss of appetite and food enjoyment. And so then you can see with physical functioning, if doing everyday things becomes more of a struggle, you're going to become more sedentary and less active because it doesn't feel good. It's not as enjoyable. And you can see from that cycle that it just sort of propagates. And I show this slide for two reasons. Number one, I think it's really important to know that there's a physiological reason why exercise is harder for people with kidney disease. And I think the people who I've talked to do try to beat themselves up and say, I know I should be. But listen, give yourself a break. There is an actual physiologic reason, and this is just one, why it can be more difficult. But I also think that this slide is nice in the fact that it shows you that we can break the cycle by working on that middle rectangle, the physical activity. That if we start promoting that we can interrupt this vicious cycle of deconditioning and having less life participation. So does it actually help? What do the studies tell us? So we do know, and we can tell you that no matter what your stage of kidney disease, that regular exercise, something like 3 times a week, and how long depends on, where you are starting. But we do know there's benefit from even just doing 10 minutes at one time to start with. That if you do that, you can improve quality of life for the physical aspects. So how you feel functioning in your everyday life. We know that we can actually improve objectively measured things like fitness. So it is easier to walk upstairs and get around the grocery store. And we do know that we can increase your strength, your ability to get in and out of a chair and get in and out of the car and around easily. We know that we can make people walk further than they did before they started exercising.
Let's see, so kidney is a... These are my grandpa's kidney stones. They're very precious. Kidney is a bone in your back that helps you turn. I don't know, to be honest.
They don't know kidneys are vital, do you? Get the facts at kidney.ca.
There's been probably the most research on the benefits of exercise in people with kidney disease on those people who are on hemodialysis, in-center hemodialysis. And I think that's for lots of reasons. It's a good place to test things because people are there already and they'll tend to do it regularly. So what they've shown is that it is a fairly effective therapy for decreasing restless legs, those symptoms, if you exercise during your treatment and that's when you experience that symptom. And so people will often ask for the bike when they're on their dialysis machine when they start feeling their restless legs coming on. There's been several studies to show that it improves depression scores, and that's just from doing cycling during dialysis. And there's some evidence to also show that you can enhance phosphate removal by cycling on dialysis. Just by letting the circulation and the blood flow to the muscles increase, you access those extra compartments and can help clear phosphate. We don't know as much about other symptoms. Certainly people anecdotally in our program have found cycling during dialysis very effective for decreasing the severity and the frequency of cramps that they get when they run. We don't know the effects on activities of daily living as well, and that's what I find really interesting is can we help people be more independent in their homes for longer, particularly for people doing their own dialysis at home. Could a regular exercise routine keep them independent doing their own dialysis at home for longer? And then sleep. Sleep is a big problem, and so that's somewhere else where we need a little bit more research. There's been some evidence to show that we can improve the quality of sleep, but still there haven't been that many studies. And so that's what the research says, but what do our patients say? And these are selected quotes from people in our program over the years, and I picked them because they're the ones that we tend to hear the most often. So I'm more steady on my feet. My legs were pretty shaky before, and now they're not. I had restless legs, and I still have it, but surprisingly not as drastic. Like I do a fair amount of walking myself, probably 12 blocks a day, and so my legs were fairly good, but I cannot keep up to my wife if we went shopping. Now I can. Oh, I get cramps. Every dialysis run I had cramps, but after doing exercise, I have no more cramps now. So that's a common one. So I've told you all about the benefits and I've talked about it like there, all you have to do is do it and you'll get the benefits. But I think we all know and we can all acknowledge that actually starting an exercise program and sticking with an exercise program is very difficult. So we cannot pretend that it is, you just give somebody some equipment and they'll get the benefits. It's a complex behavior. So why is it so hard? And this has been actually pretty well researched in people with kidney disease, particularly people on dialysis. So what is the particular barriers for that group? And so what patients have said throughout the literature is that really there's this fear of injury, not knowing what to do or how to do it, the need for an exercise companion. And then of course there's the feelings, these sensations of symptoms that you experience when you exercise that you may have already, like weakness and shortness of breath. That is a little unnerving if you don't have body confidence that this is safe. So those are some of the barriers. And, the barriers for nephrologists and unit staff are also very interesting. And the common one that comes up is no time. So no time to ask about it, no time to counsel about it. I think that we don't have a great knowledge of exercise unless it's your personal interest. And we also make an assumption that patients aren't interested, which actually is not true. When we've done a number of surveys, and not just myself, but across countries, what always comes across is that patients are actually pretty interested in exercise. They just don't really know how to start, or if it will benefit them. And they actually, 25% of patients in one survey of about 400 people in Canada, they thought that they actually couldn't safely exercise. So 25% thought that, which is a good deal higher of what we would really expect. There actually are very few contraindications to starting an exercise program. I've focused a lot on exercise, and so when we hear the word exercise, we all have notions about what that means. It is a planned, structured activity. But I really want you to come away from this talk appreciating that all movement counts. It could just be getting dressed. It can just be walking up to get your mail. Movement counts. And I think that was really summarized by this patient in this editorial in a very, popular nephrology journal. What her comments were about this issue of how we talk to people about exercise really resonated with me. So this lady who's lived with ESKD herself for many years, she's been on dialysis and she just recently was transplanted, offered the following. As a patient with kidney disease, most of my days, I'm in a constant fatigued state. How can I exercise when I'm already tired and short of breath? During those times, my body will not allow me to exercise when simply walking from one room to the next has already elevated my heart rate. Maybe we need to redefine exercise. Although there are standards that have been set forth, we also have to consider that some activity is better than none. And I just wholeheartedly agree with that. I found that very poignant. So just think about being more active and how that can actually make you feel better rather than what you should be doing. How can it be more enjoyable? Social connection is one very, very obvious one. Ask your care team about getting individual advice. Can I talk to the kinesiologist? Do you have a kinesiologist? Why not? You need to ask for it and about it.
Thanks to all the car donations made to the Kidney Car program, the Kidney Foundation of Canada can help all these people with kidney disease. Those donations are instrumental in providing them with care and invaluable support. When you give your car to the Kidney Car program, it will be towed for free and recycled or resold. You'll also receive a tax receipt of at least $300. To continue to improve the quality of life of thousands of patients, we need your car today.